Hi, I'm Dr. Colleen Cotton. I'm an associate professor of dermatology and pediatrics at the George Washington University School of Medicine and Health Sciences, and I'm an attending physician and director of our multidisciplinary pediatric HS clinic at the Children's National Hospital in Washington, D.C. So we think about characteristic skin findings or skin lesions in HS, but there's a number of different skin findings that you can see, which does make it a little bit difficult to be sure that that's what you're looking at versus something else. So we do see very mildly, and you really have to look for this in some patients. We'll see open comedones in areas where we shouldn't see open comedones. So typically we think of comedones as being associated with acne. That's going to be the face, the chest, the back. But if you're seeing what look like blackheads in the underarms, in the groin, on the inner thighs, those are areas we really should not be seeing those and typically only see them in the context of HS. You can also see what are called double-headed comedones, which are like two little blackheads that are connected to each other under the skin, which is sort of like the earliest, most proto version of a tunnel that we can see. When those two hair follicles connect further out and have a larger connection, that's when we tend to form tunnels. Um, if you're also seeing somebody who has an abscess in a skin fold and not, in an area outside of a skin fold, that should raise your suspicion for HS as well. Now, it can be hard to differentiate like an epidermal inclusion cyst that's gotten inflamed versus, an actual infectious abscess from HS, especially if it's the first time that this has happened. If it's the second time this has happened, very unlikely that it's an infectious cause. You want to think about getting a culture of anything that drains from that, because if you have, for example, 4 plus methicillin resistant Staph aureus, okay, we're probably colonized with MRSA. There's probably repeated MRSA abscesses. But if it grows a bunch of stuff, or if it doesn't really grow anything, it just grows normal skin flora, or it grows something weird like Prevotella or Bacillus cereus or just, there's different things that can grow. And so if it grows any of those things, and it's even though you had like a lot of pus or something coming out, that's much more suggestive of HS. Um, and so you can also look to see, even if they say this is the first time, do you see evidence of scarring? Do you see post-inflammatory hyperpigmentation in these areas? Do you see those open comedones? Because if you can see those clues to past disease activity, that can also help you make that diagnosis, even if this is the first like severe flare that they've had where they're presenting to care. You can also ask to look at other areas. So if they're coming in for an abscess in the underarm, look at the other underarm. If they're comfortable with, look at the groin area, because oftentimes you may see these clues, scarring, post-inflammatory hyperpigmentation, open comedones in these areas where patients may not recognize that they have them, but that can give you a clue as well. Folliculitis can also be very difficult to differentiate from HS because both are follicular disorders and both cause inflammation around the follicles. But typically, folliculitis is going to be more pustular. It's going to be in more areas of, you may see folliculitis on the lower legs, you may see folliculitis on the buttocks, and sometimes, particularly in patients with trisomy 21, you can see both of those overlapping. So it can be really difficult. It can be really challenging to determine the difference. Folliculitis, luckily, responds to the same types of treatments that mild HS will respond to. So, antiseptic washes, oral antibiotics for severe flares, topical antibiotics for active lesions. It just depends on whether you can get that under control easily, which would be more folliculitis, or if they continue to have flare-ups, which would probably be more HS.